It says meeting is streaming live. So great. Hello, welcome to Doc Talk Live. I am with Dr. Hafiza Khan, and Dr. Khan is a cardiologist in Texas. Welcome. Thank you for coming on.
Thank you.
She's sort of a kindred spirit, I would say. Before the show, we were chatting a little bit about what Hafiza does, and she is a cardiac electrophysiologist, which means that she looks at the electrical part of the heart, the electrical system of the heart. But she is on Instagram called Heartbeat. Is that right? Heart.beat.
Yes. Doctor.
And
Heartbeat doctor.
say that again.
Heartbeat doctor.
Okay, on Instagram. And kind of like Doc Talk Live, you have this sort of alter ego, if you will, where you want to educate people about heart issues in an Instagram type way, which is very brief, very image focused type way. Could you talk a little bit about how you got into that?
Yeah. So, as a practicing cardiologist and cardiac electrophysiologist, for a new consult appointment, I'm given 30 minutes. For a follow-up appointment, I'm given 15 minutes. So that's such a time limited space. And by the time somebody sees me, they've gone through a primary care physician, they've gone to a cardiologist, and the general cardiologist has decided that the issues are complicated enough to see me, a cardiac electrophysiologist. So patients by that time are terrified because they've gone up the food chain. And what they need to do is understand, how did they get to me? Most people don't even know my specialty exists. But the heart is complicated, just the way a car is. You need an ignition for the car to run. I'm the ignition. You need gas in the tank for the car to run. Well, those are the plumbers, the interventionists. So they need to, I want my patients to be well. Wellness involves understanding what is happening in your body. How did we get to be seeing a sub specialist? Because I am a proceduralist. I do ablations and other things, but once the heart rhythm acts up, it's the tip of the iceberg, and underneath there are a whole lot of issues that need to be addressed. Sleep apnea, hypertension, salt intake, alcohol intake, and that all culminated in my problem. But my problem is the last domino to fall. I can't address mine without addressing the 5 other dominoes in 30 minutes. How do I talk about their alcohol, their neck circumference, the salt and their blood pressure? So Instagram gives me a way to educate because it has different formats. There's the picture and the text, but I can also do a slideshow, and they have a 15-minute IGTV where I do chalk talks. So it's a fun way.
So this is a little bit of a chalk talk today with me.
Yes.
And so it sounds to me that people get to you mostly because of lifestyle issues. Is that fair to say? Whether they're not sleeping properly, whether they drink too much alcohol, whether they're obese or eating too much, these things lead to the electrical failure of the heart. That's what I'm inferring. Is that correct?
Yeah, so I'm not going to call it failure, but I'm going to call it electrical stress. So I would say the beauty of electrophysiology is everybody's got a heart. So whether you're a newborn or whether you're 100, you can have a heart rhythm problem. So I think that about 10% of my patients have congenital related arrhythmias like WPW that are not lifestyle related. But increasingly, most people are having atrial fibrillation, irregular heartbeats, skipped heartbeats. And those are triggered by external forces pressing in on the heart. 10% of my patients also are at advanced age, and they just have wear and tear on the heart causing they're 80, 90. So they did good. But, if you have a pulse of 65 beats per minute. That means that in 1 year, your heart beat 33 million times. 33 million times in 1 year. So it doesn't fail. What happens is the load given to it is too much for it to bear. It's the little engine that could.
So there have been a few instances in my life where my heart would skip a beat, or I'd have a lot of PVCs, and I go through the $1 million workup, and other than anxiety, really nothing really shows up. And I would
Because the
imagine,
brain is powerful.
right. So what's going on there?
So that's called triggered activity. A normal heart can be pushed off the edge of a cliff if you throw enough things on it. So what I tell my patients is, in order to have a fire, you need to throw matches. Okay? So life is us throwing matches on our heart. Something ignites. What are those matches? Lack of sleep, disordered sleep, uh, excess caffeine, and I'm talking about over 400 milligrams. Alcohol as a method of stress reduction. My friends, there is no healthy amount of alcohol for the heart rhythm. Carrying around extra weight, a backpack full of 80 pounds that your heart has to lug around. The fight or flight reflex, chronic stress with cortisol. Each one of those is a match. And sooner or later, you throw enough matches, there's a bonfire.
Hmm.
So the heart is normal, but you've thrown matches, so you've triggered it. That's called triggered activity. So the answer is not in the doctor's hands. The answer is to allow you to understand the matches so that you don't throw it and light a fire.
And it's a very I don't even know how to describe the feeling.
I have them too. They're thumpers.
Yeah.
Flip, thump, flop. Deep breath. Thump, flip,
Right.
flop.
Yeah.
Yeah, they're thumpers. So those are triggered activity. Intracellular high catecholamine adrenaline states create increased calcium inside our heart muscle cells. So that calcium is a positive ion, and the cell depolarizes and then ping, thump, flop.
Let me see if I can share my screen, and let's look at your Instagram. Let's see what's happening here. Share. Okay, do you see your Instagram?
I do.
Perfect. So
So there's my
top.
there's my handle. I started this about a year and a half ago. Miraculously, I have reached 35,000 followers. And like I said, it's visual. So if you, some of those posts, if you click on the post from yesterday, it's about atrial fibrillation and the lifestyle issues that cause atrial fibrillation. I
So
uploaded that.
there's a 13-minute video here.
Yes.
And then there's a little clip here. This is wonderful. Atrial fibrillation, most common type of arrhythmia in the United States. So just give us a little blurb about that, Hafiza.
So right now, the European Society of Cardiology is going on. And Brad, if you click the video, it'll play as we're talking.
Oh, nice.
So I am used to giving PowerPoint presentations when I speak to other physicians, but I'm able to create, you see here, a PowerPoint and upload it as a video. So I explain the scope of the problem, why AFib is important, and the European Society of Cardiology came up with a great infographic about the ABCs of treating and managing AFib, preventing a stroke, helping with symptoms, and looking at triggers. So do you see, this is a 15-minute PowerPoint with graphics that are aimed to help people. So there's the caption, there's the video, and that's the European Society of Congress. That's hot off the press. That was last Friday. So they can watch this, they can pause it, and then there's a space for people to message me for questions for a deeper dive in that.
That's awesome. Are there comments there? Are there any comments yet there? How would I?
Yes. Yeah, there are comments there in the comment section. And the the today's post, I was thinking of doing yoga and AFib. So yoga, for example, reduces adrenaline and it actually helps AFib. So yesterday's post was about this fish oil derivative called Vasipa, which actually dissolves plaque. It's
Where is that one?
miraculous.
That
That's that one.
that one. Okay.
So this is about medical grade of EPA. It's a fish oil, and the study was published, or literally 3 days ago, at the European Society of Cardiology, and they found that patients taking high dose of this EPA omega-3, they had the plaque in their arteries actually decrease in size. It regressed. It dissolved plaque. I mean, that's miraculous.
Absolutely.
Absolutely. So it was a small study, 80 people. Half of them got mineral oil tablets. Half of them actually got the potent omega-3 EPA version. And the people who got the mineral oil, their plaque increased. So if you swipe to the next slide, that one I did as a slideshow. If you,
Swipe to the next slide. Hold on.
yep.
I see. Yep.
So this was these were the studies. So these are all New England Journal studies. And so the fact that 4 grams of a drug called Vasipa dissolves plaque inside the arteries of people within 9 months, that is phenomenal. I mean, this was the study. It's called Evaporate. So Vasipa evaporated the plaque. So this was
So are you
presented.
taking this now? Is this a over-the-counter thing? This
No, it's medical grade ethyl ester of called Vasipa. So it's icospentyl ether. It's a company in Ireland, and they took Pacific herring. The herring has, omega-3, which is DHA and EPA. They took the EPA and they made it into a ethyl ester. So it's ultra purified and it's the ester form. So it's more bioavailable. So it's a prescription drug. So these were people obviously who already had plaque, because you have to have plaque to show that the plaque dissolves. Okay.
Sure.
So these weren't people who were healthy. They had plaque, they had diabetes. But if you swipe forward on there, you'll see one more, a couple more, and you'll see. So I try and put like emojis. You have to make the information visually appealing to people. If you click forward a couple more. So this was just presented literally on the 29th. And
Wow. So
so
this
one
is
more.
very current.
So yeah, so the
Let me
average
ask you,
person has access to this through me.
let me ask, when I went to Emory Medical School and they were big cardiologists, and one of my professors was Dr. Nanette Wenger.
Oh, she's obviously very, very famous. Obviously, she's a leader.
But she was very focused on women in the heart.
Sure.
And she was, because back in the 70s and 80s and 60s, a lot of it was, all the studies were done in men, not in women.
Mm-hmm.
And she sort of harped that women's heart problems are different than men's heart problems. Could you comment on that for us?
Yeah, so the traditional risk factors are high blood pressure, high cholesterol, diabetes, smoking, and obesity. But women have additional non-traditional risk factors. So having gestational diabetes during your pregnancies increases your risk of heart disease later on. This is polycystic ovary, PCOS, polycystic ovarian syndrome awareness month. And women who have PCOS have an increased risk of heart disease later on, again, because they have that metabolic derangement. Number 3, women who undergo fertility treatments have an increased risk of heart disease later on. Women who have preeclampsia have an increased risk of heart disease later on. So pregnancy and the attempt to get pregnant is a stress on a woman's body, and it unmasks her underlying predilections that could then manifest 25 years later when she's postmenopausal.
The, the
So,
the other thing I remember, and correct me if I'm wrong, but sometimes it's harder to pick up on heart disease in women. Like they don't have the EKG changes that necessarily a man would present with.
and absolutely. So in the old days, yours and mine generation, we had, nuclear stress tests and EKGs, which are artifacts. But now we have cardiac MRI and we have 3D CT images with flow, and there that cuts through all the surface issues like breast tissue. So cardiac CT imaging, it's a virtual angiogram, and any artifact due to a woman's breast size is eliminated. So there's a revolution happening in imaging because of AI and post-processing of that image. So kind of the CGI in the cardiac world.
Do you have any of those images that on your, if I went
I,
back to share
you,
screen?
yes, so I have one on cardiac MRI because in this COVID era, your viewers may know that there's some controversy about playing sports after a sports person has had COVID. And that's because if you go down a little further, some patients may have mild COVID. A little further down, uh, some patients may have mild COVID, but they have microscopic heart damage that can manifest only on a cardiac MRI. So a little lower down. There, the image, that's it. So these sort of images, if you click forward on that, and I talk about it. So this one, there it is. I'm just at a
Cardiac
Starbucks.
MRI really
Oh
helps
dear.
my specialty.
There. So
Yeah.
sometimes you see I put an audio on there
Yeah.
because some things require me to speak. It's hard to say it in the caption limit of,
Sure.
but it's a visual. These visual things are perfect for Instagram.
Right.
So that's an image of a cardiac MRI sliced, and you can see the muscle of the heart. I mean, there's new ways to impart legitimate medical information that catches people's attention, but I understand that the attention span is small.
Yes, that's true. So just to wrap up, you're really trying to, well, we can go a little longer. I have lots more questions, but you're really trying to get people to make lifestyle changes. And so, what are some of the
People need
life?
to be well. Yeah,
Um,
wellness involves owning your body, owning what you do to your body. I can do ablations, but 3 hours in someone's heart doesn't make them well. So wellness involves managing stress, that fight or flight reflex. Wellness involves being metabolically resilient so that if you get infected with a virus, your body has the ability to fight it off. What is metabolic resilience? It means not having to carry around 50 extra pounds of weight. It means having a good blood sugar that's not necessarily diabetic range, but not even a slightly high. Managing stress because cortisol decreases your immune system. So why do young people succumb to COVID or get serious COVID? It's because they're not metabolically resilient. They think they have no pre-existing conditions, but obesity is an inflammatory condition. We cardiologists know that because it creates oxidative stress. So I want people to realize that their heart is a miracle. The heart is the first organ to form. 8 weeks post-conception, that little cluster of cells generates a heartbeat. 8 weeks post-conception.
I thought
Okay.
it's day 22.
Yeah.
I thought
So
day
day
22
22 is, yes,
a
it starts
heartbeat.
forming, but there's an audible heartbeat at around that time. And so the human heart forms the first because it's important. Our creator made a cage for it because it's so important. It's precious and needs to be protected.
So
It
I want.
beats 35 million times.
So
Don't take it for granted is my message.
have are you you need to do a TED talk. You're that dynamic. Are you getting ready to do a TED talk one of these days?
Oh, you know what? I love the heart, and it's a miracle. The human body is a miracle. I feel like people take it for granted and let until something happens, and then they're like, "Oh, how did this happen?" So if I can prevent the train from going off the tracks, I'm there when the train crashes. But if I could help people to not go off the tracks, well, that's where we physicians can provide the most value.
Before the show started, you mentioned that you needed a creative
Hobby.
way, a creative hobby. So tell me about your hobbies before, and then tell me how you got into being a Instagram blogger.
So I have two grown sons. I have a 24-year-old and a 20-year-old son, and I'm an empty nester. So I'm used to being busy at work and then coming home and be busy with my sons and their golf and their activities. So I would come home after they went to college and have nothing to do. So I love to talk, I love to educate, and
Right?
it's creative. How do I get my message across in a way that's visually appealing and succinct? Because doctors can drone on and on and on. I mean, you've been to those PowerPoint grand rounds, right?
Yeah.
So, so there's
And our
creativity,
attention span is so bad now, right?
and it's visual, right?
Yes.
So how do I create the information that's succinct, visually appealing, and accurate? So there is creativity in that, and
Apparently,
it's fun.
There's a question for you. What is the specific omega-3 dose and type?
So for that study, omega 3s are two types, DHA and EPA. DHA is the brain omega, kids' brains development. EPA is the vascular omega. So VASIPA is VAS, vascular EPA, vascular EPA. So uh, EPA, and it was 2 grams twice a day. So 4 grams, which is a very high dose of this ultra purified ethyl ester. So it's not something that you would get at GNC.
So
You'd have to
what would you do in the meantime since this is not available?
eat fish.
Eat fish? And is there a specific type of fish like
Yeah,
salmon or in
fatty fish. The American Heart Association recommends at least 2 servings of a fatty fish. Um, I'm not a big supplement fan. I like to for my patients to get their nutrients from the food. But if any of your listeners are vegetarian or vegan, fish get their omega 3 from algae. So algae are the original creators of the omega 3. Then the fish eat it. So the fish meat contains omega 3. So if any of your viewers are vegan or vegetarian, algae oil is a way to get omega 3 without eating fish.
and
I'm a fan of eating the food.
is there a specific type of fish you recommend and a specific way it's raised or any of that?
Yeah, farm raised salmon have less omega 3 because they have to eat the algae. Okay, fish contain omega 3 from eating marine algae. So um, farm raised salmon will have less mercury because our oceans have mercury, but they
Uh-huh.
will also have less omega 3 because those algae are in the deep ocean.
So it's a trade-off.
So that's why, uh, you know, algae oil is a legitimate way to get EPA and DHA without getting, mercury. And for people who don't like fish or don't have an adequate amount of fish intake.
Hafiza, I want to thank you for joining us. I would love to have more questions. So I want Doc Talk Live to grow like your show, but my goal is ultimately where the interview is driven by people that are watching live, and they can either somehow zoom in or participate um, and ask questions of you instead of me. It's the
Well,
long
also,
goal.
if they ask questions later, I'm happy to go and try and answer some of those on your Facebook page.
I appreciate it. Thank you so much, Hafiza.
Thank you.
It was really fun. So
Bye bye.
I'm gonna end this end meeting. No, I just want to end on the live. Hold on, Hafiza.